I'm Debbie
Hi.
Smith. We're going to talk about Alzheimer's, schizophrenia, and epilepsy. They already talked about Alzheimer's, I think twice already. It's a chronic, progressive, neurodegenerative disease. There are a lot of risk factors. It's a combination of genetic, lifestyle, and environment risk factors. There's some things that you should look for in family members not able to orient close to their body, getting lost on a familiar route, or if they can't identify or find objects in their direct view. The next two.
And on Alzheimer's disease is a neurodegenerative disease, as you said, and it affects people 65 years and older. You can have Alzheimer's disease at a younger age, but it's prevalent in older people, and it was discovered in 1906 by Alois Alzheimer's. He was a doctor with a patient that had abnormal behavior, forgetting things, and once she died, he did an autopsy on her brain, and he saw something in her brain, neurofibrillary tangles and protein, alpha-betaline protein in her brain, and that is a sign of Alzheimer's disease. There's no definitive way to diagnose Alzheimer's disease. It's diagnosed upon death. You can go and monitor a person over their lifespan and see that they have some type of dementia. And most of the time, they have found that it is Alzheimer's disease. And Alzheimer's disease is diagnosed as a person ages and a patient dies from that disease between 4 and 8 years after diagnosis, because the majority of the time the person has started suffering from this disease long before we pick up on the signs that they have it.
Just another thing, she said there's 5 symptom categories, and there must be 2 of the symptom categories present for diagnosis.
And this is an Alzheimer's disease brain, and once you notice it's a healthy brain on this side, and as you go, the brain will shrink and dehydrate, and once it starts doing that, the person loses all of the ability to do things, because the brain is like the computer that guides the body, and if the brain is not functioning, then the body don't exactly know what to do, and all of the nerves and neurons in the brain start to die, and that's when the brain starts shrinking, when all the nerves and neurons start to die. Okay.
So do schizophrenia next.
Okay, and our next disease that we're going to discuss is schizophrenia. Schizophrenia is also a disease that affects the man, and a person suffering with that disease has hallucinations, they hear things, they have this feeling, some of them have this feeling of grandeur, and the only way it can be treated is through medication. Young men are diagnosed with the disease between the ages of late teens up into their mid-20s, and females are diagnosed between late 20s and their early 30s. And the medication, there's medication that can treat the disease, but there's no cure for this disease either. And when a person is diagnosed with it, they would also go through a set of factors like signs to understand that it is schizophrenia. And it's a mental disease, a mental disorder. And you see a lot of the school shootings with young people shooting up the schools, and they have voices in their head. They hear things that we don't hear, and they see things that we don't see through some type of dysfunction in their brain. And if we diagnose them, we catch them at an early age and we diagnose them, we can treat the disease. But if we don't catch them at an early age, it's harder to treat the disease. And if the patient don't stay on their medicine, it gets to a point in their life where the disease, the medication would not treat them, it will not have an effect on the disease. I have a brother suffering with schizophrenia, and he gets very violent. And now in Alabama, you have to go and put in an order with the probate judge to have them treated. But if that patient decides that they don't want to go peacefully, then the sheriff will leave them alone. They will let them sit And even the police will not arrest them because they don't want the stigma of trying to hurt a mentally ill person to get them treatment. But that's not good for society either, because they can hurt someone. Because my brother he became upset one day and he jumped on a family member and he actually tried to hurt him. But schizophrenia is a disease is growing in the United States, especially in Alabama.
So I'm going to talk about epilepsy. It's a disease. It's also known as seizure disorder. It is characterized by recurrent, unprovoked seizures, or they can be provoked. Sometimes there's triggers, like a main one that's known trigger is like strobe lights. A lot of times those will trigger epileptic attack. There are many different types of seizures. The types of seizures tell what is happening in the seizure. So there will be like generalized seizure. You see that there's a lot going on in the brain. Focal seizure, it's focused to one part of the brain. There's some that are called absent seizures, where you kind of like become absent. You can have grand mal seizures where you shake, and there's the names of the seizures describe what is happening with the person during the seizure. So it's very important to pay attention what's happening when someone's having a seizure. There's a lot of causes: age, genetics, if you're on the autism spectrum, having a fever, infections that cause a fever, stroke, any brain damage, and then some other triggers besides the strobe light: not getting enough sleep, stress, or if you come off your medications. The treatments are medications. There's also neurostimulation devices that they've started to come up with. You implant into the brain, and it can tell whenever you're about to have a seizure. It'll trigger it so you won't have the seizure. And then other mental disorders might also be present. So schizophrenia, depression, they can also be present with epilepsy, because it's all caused by brain damage. So any type of brain damage can cause epilepsy. And some main points to remember: if you see someone having a seizure, don't try to restrain them. You want to turn them on their side. Don't put anything in the mouth. A lot of times people think you want to do like a blind sweep in the mouth to make sure they're not choking on anything. They're not. They're going to bite your fingers off. So definitely don't do that. And know the triggers. So like if a strobe light's going off, someone has a seizure, turn the strobe light off. So whenever they're done, it doesn't happen again. And that's about it. Cradle their head. And in conclusion, we talked about all these diseases, and they're all a combination of genetic, lifestyle, environment factors. There's many different things you can do to prevent the diseases, but mostly they're all caused by some form of brain damage or a deterioration of the brain.